Hey everyone! As part of the Neurogram and Mind to Mind collaboration campaign, Epilepsy Awareness More Than a Seizure, we have Dr. Parthvi here with us today. So, Doctor, can you please just introduce yourself a little bit about where you're from and your relation to epilepsy?
Yeah, hi everyone. I'm Dr. Parthvi from India. I practice neurology in Mumbai and I've finished my MD in internal medicine and followed by a specialized degree in neurology. And epilepsy has been a huge part of our training because I think India represents a huge chunk of epilepsy patients across the globe. So, and it's also a matter close to my heart because we've seen so many epileptics starting from the pediatric age group to the adult epilepsy as well as elderly epilepsy. So I'm glad to be here and talk about epilepsy and thus helping in the great initiative that you guys are doing, epilepsy awareness.
All right, great. So just to start us off a bit, could you tell us a little bit about the neuroscience behind epilepsy, such as the specific causes of epilepsy and what exactly happens in the body and in the brain during a seizure?
So, seizure and epilepsy is two different things. A seizure is the physical act that happens when a person is having electrical dysfunction in their brain, like the hands move and repetitively twisting, jerky movements, or the legs move, the torso, your trunk, and the mouth gets twisted to one side. All that is a seizure. That complete act comprises a seizure. And when it is a part of a syndrome, like the person has other problems too, it amounts to epilepsy. And so the neuroscience behind it is basically the brain has a lot of electrical waves going on inside it at all times. Right now I'm talking to you, I have some waves in the brain. When I go to sleep, I have some other waves in the brain. When I'm really concentrating, there are a different set of waves in my brain. So when sometimes when all of this goes haywire for, let's say 30 seconds, 15 seconds, or even a minute in worst case scenarios, or even more, then that is what is a seizure. And that electrical dysfunction in the brain leads to a person just moving his entire body uncontrollably. And so you don't want that electrical dysfunction in the brain. Now that happens mainly because of some kind of electrolyte imbalance, or you can say chemical imbalance. Suppose somebody's sodium is low, or somebody's sugar is low, or somebody has some infection in the brain due to which there is a lot of transport of chemicals in the brain and outside the brain into the blood and things like that. So that chemical imbalance leads to electrical imbalance, which leads to motor imbalance. Motor meaning we get seizures. So I guess that's pretty simplified, very, very generalized description of a seizure.
What sort of treatment options are available for people with epilepsy right now?
That's a long answer, but to cut it really short and just tell you in brief, epileptics need to first of all have symptomatic management. Like they need to stop the seizure whenever they have it. So that's, I think, a huge motive of your program, Epilepsy Awareness, to teach people how to treat a person when you see him seizing on the road. That okay, this guy is having a seizure. What is the first treatment that you can give? The main thing is that you turn them on the side and then just take them to the nearest most primary care center without putting anything in their mouth, which is a very common thing people do. Try to give them water and ask them to smell something and everything, which might precipitate a further seizure. So instead of that, just take them to a nearby center. Then the treatment actually starts, the medical treatment, giving them anti-epileptic drugs, which will soothe the brain and the probably streamline the electrical activity in the brain. So they are called anti-epileptic drugs. There is a wide, huge menu available of drugs in the market. Your doctor will decide for you, but those drugs will really are catered as per the patient's entire profile, age group, gender, what type of seizures they have, and what is their social situation, everything. So those drugs are one part of the epilepsy treatment. Then there are some epilepsies which are surgically resectable. Like a part of your brain has a scar which is leading to the electrical dysfunction, which I just told you about previously. So that scar region of the brain can be surgically removed. It's a big surgery. It's a major surgery. But the treatment rates, the response rates of the patients are pretty good. Their quality of life improves post surgery. And there's a huge, extensive, very comprehensive evaluation protocol for every surgery, epilepsy surgery, which every patient must undergo. So the surgery is another part of the treatment of epilepsy management. And then there is counseling and lifestyle modifications for all epileptics. Like they're supposed to follow a particular type of diet. The epileptics are advised not to drive alone, not to swim alone, such things which can be hazardous to them, just in case they have a seizure when they are doing those things. So counseling is the third part. And again, for, like, if I'm having epilepsy, I want to have something in my hand which I can give to my friend, whenever I'm out, that if I'm going to have a seizure right now, I want some immediate treatment. So there's this spray called midazolam. It's a benzodiazepine drug. So that whenever you are having a seizure, it's just a nasal spray. Take it out of your bag and spray 2 puffs in your nostril, 2 to 8 puffs in your nostrils, and you might avert a huge seizure. It's just going to give you temporary relief from a seizure, just in case you use it in the start of your seizure, or if you feel you're going to have a seizure, which many patients do. So it averts a huge catastrophe by using such emergency seizure controlling medications. So I guess that's in short about the treatment options available for epilepsy.
All right. So next, could you run us through some of the recent research you've seen surrounding epilepsy?
Yeah, sure. So recent research includes a lot of things about genetic epilepsies. Genetic epilepsies include those which can be transmitted from parents to children, from to multiple generations, even from grandparents to their grandkids and things like that. So the one thing is genetic counseling, that is very much upcoming for epilepsy. Then a lot of dietary modifications. Like now there are a few amino acids which they've localized, like say lysine and alanine. If you have a diet which is specifically increased, including those amino acids, a lot of seizures can be reduced in frequencies. Then there's this vagal nerve stimulation. It's a time tested method, 10, 20 years down the line, but they're bringing a lot of variations in the VNS. They call it vagal nerve stimulation techniques, so that you can control your seizures. It's specifically for refractory epilepsy, patients whose epilepsy is not treatable by medicines, whose epilepsy is just not getting controlled despite having n number of drugs. So then VNS modifications are a new thing. And besides that, a lot of research is ongoing in newer anti-epileptic drugs. Like we have all drugs, all, like you might have read in pharmacology that all drugs are first generation, second generation. Now the late third, fourth generations for anti-epileptics are coming up, including newer drugs like parampanel, brivaracetam, and those drugs have different mechanism of actions as compared to what the pre-existing drugs had. So then we have a huge armamentarium of drugs to combat epilepsy. Like you can give the first generation drug, it will target one part of the cell. You have second generation, it will target another part of the cell. And now the newer generation is coming up, which will target completely different part of the cell. So all three drugs given together, they have a synergistic effect. So science is really working wonders for epilepsy management right now. And it's a very exciting time to look forward to in research epilepsy.
Could you talk us through the relationship between epilepsy and genetics? I know you talked about this a little bit with the treatments.
Yeah. Well, genetics and epilepsy, as I said, inheritable conditions. Also, they are more of those epilepsies which present in childhood. Like if I am going to have a mutation from my mom, I'll most likely seize in the first 5 years of my life, rather than some epilepsies which manifest in the 20s, 30s, and things like that. So early manifestations is one thing. Sometimes they are refractory to treatment, so patients need to be on lifelong anti-epileptics. That's a sad part, but that's how it is. And some genetic epilepsies are really good in the way that they have a deficiency of the enzyme in the body, and then if you supplement that enzyme to the person, they have very, very, very good control of seizures. Like we have GLUT1 deficiency epilepsies, so they have such a phenomenal response to giving them the enzyme replacement therapy. So that's one good part about the genetic epilepsies.
All right. So, what are some common myths that you've heard people mention to you about epilepsy, and could you talk us through the truths behind them?
That's interesting question. So, as you know, I practice in India. So, India is a land of lot of superstitions, a lot of superstitions. So, we face a lot of patients coming to us with, suppose if a young female has seized at her place, they always think that a goddess has entered her body and they just hit her with a broom, and while she's seizing, and then they've physically injured her so much in order, thinking that the broom hitting will make her stop seizing, which is completely a myth. All this is, of course, in the uneducated and rural areas. That is one myth. It's not any goddess entering your body. It's nothing supernatural. And a lot of rural population of India needs to be educated about epilepsy being a proper medical disorder, and it does not have to be anything supernatural. So that's one thing. A lot of NGOs over here are working towards it, luckily, and hope they are successful in that. Secondly, we a lot of patients, even in our urban population, they come to us when they tell us that we just saw this patient seizing, so we asked him to smell the sole of his footwear. So he's seizing, and some bystander made him smell the sole of his footwear. You can imagine how traumatic it is for the patient to undergo this. Some people make them smell onions and God knows what, but a pungent smell. So again, that is another myth buster, that it's not going to work. In fact, it might do more harm to them. So nothing of this sort is to be done. And other than that, a lot of myths regarding social stigma are associated with epilepsy. How if you have epilepsy, you have a huge problem getting married in India. A lot of families don't want daughters-in-law and their son's wife to be having seizures or epilepsy, even if it's a very benign thing or something very well controlled with medications. They just don't want, because they feel, oh my god, that's she's an epileptic, she'll cause problems, their children will also have problems. That's so not true. And in fact, epilepsy, there should not be any stigma attached to it, because it's not something in their control. It's just a disease like diabetes or hypertension or Parkinson's. It's just a disease which is, in fact, 70% of the times it is very well controlled with treatment. So it's the stigma associated with it leads to so many complications. A lot of families, they end up lying to their to be grooms and to their to be in-laws, and they just don't tell them. They hide their medicines in the kitchen cabinet for a year after they're married, and then they take it you know like they hide and take their medicines. So much stigma is associated with it. It forces people socially to do such things of as if it's a crime that they're having epilepsy. So I mean, that's why, like, this interview with you guys was a really something I was keen to do, because your cause is very nice, epilepsy awareness, especially in a country like India. And I hope you find many followers from India after this. So let's see. So a lot of stigma associated with epilepsy, which needs to be busted with awareness.
Thank you. What you said is completely, you see these things with your patients, and it means a lot that you're on this interview and spreading awareness about it. So what do you wish people knew more about epilepsy?
Mainly that it's not a curse. It's just a disease, and every one of us might have had some illness in throughout their life. Maybe it's a common cold or it might be cancer. Everyone goes through something or the other. So just to accept epilepsy patients like our own and help them survive this. And also, like, a lot of people now know basic life support, simple life saving measures. We know CPR. All majority of the educated people know how to give CPR. So in a similar way, some awareness about how to deal with a patient who is seizing on the road, if that is included in the basic CPR curriculum, that would be a great thing, so that people don't end up damaging someone who is seizing, or giving them water and food and such, making them smell silly things and causing them harm. So those two things are mainly what I would really wish people knew about epilepsy. you guys make sure with your week awareness program you spread some, at least change one life.